What I wanted to talk about today is this little article that Dr. Paul Offit authored, and let's see, this was put out on the 15th of this month, and it was on the Daily Beast. I don't know where else it was published, but what's in it is actually what's more important. And Dr. Paul Offit is saying that there is a case for letting fevers run their course. Now, mind you, for years, I've been feeling like I have been going so against the grain, the recommendations, what the CDC has been saying, what all my training, what medical doctors think should be done with fevers. I have been beaten up. I have been criticized by Paul Offit's people who, I won't say they're his people, but they're his supporters, very pro-vaccine people who have vehemently criticized me for saying exactly what Paul Offit has said in this article today. And so I'm not here to actually tell you everything that's in the article, because I've been speaking for years about the problems with reducing fevers. I've been saying things like, it's like muzzling your attack dog when your house is being broken into. And all the while saying this, even though I knew it was true, I was just a little bit afraid because I knew I was going against the grain by saying it. However, I also knew that I had medical literature to back me up should I ever be in a court of law having to defend myself for some reason. So there have been articles out since at least the 1970s, but I would suspect probably for over 100 years, talking about the benefits of fever and the survivor, the increase in survival in people who have fevers versus people who don't, either because they can't mount them or because they're being suppressed. So this article is called Feel the Heat, and I just want to go over some of the primary points that were made. And then I want to tell you why I find this really disturbing. So here Dr. Offit says, when we treat fever, we handcuff an important part of our immune response. He goes so far as to say that antipyretics increase the severity of infections and that we have to get over our fear of fever. Okay, then he talks about the mid-1970s, the scientists that showed that if you give lizards an infection and you put some of them in the cold and some of them slightly warmer and some of them much warmer, there's a gradient in survival. The ones that are the most warm are the ones that survive. The ones that are put in the cold all die. Okay, we've known this for a long time now. No big deal there. Then he talks about all the medical well, not all of them. He cites a few of the medical articles talking about how fever reducers prolong the secretion of microbial agents, including salmonella, about the survival rates, about the symptoms in people. They are prolonged when you lower fevers. Chicken pox he mentioned, we'll get to that in a minute. And here he says, another reason is the fear, another reason for treating fever is the fear that high fevers cause brain damage, a concern that hasn't held up to scientific scrutiny. Yet another reason is the notion that treating fever will prevent febrile seizures, a phenomenon that, while frightening, doesn't cause permanent harm. Well, I'll have to say that actually Dr. Offit is slightly wrong on that, in that there are some people who do have febrile seizures who do go on to have ongoing seizures. So that's not exactly true. As it turns out, antipyretics don't prevent febrile seizures. Well, that's also probably true. Then, my favorite part of the article is where he quotes Hippocrates, who lived around 400 BC. He said he had it right. He believed that disease was caused when one of four humors, black bile, yellow bile, blood, and phlegm, was produced in excess. Fever, according to Hippocrates, cooked the raw humor, leading to healing. Wow. Like, isn't that wonderful that now we can quote some of the old wise men of infectious diseases? Maybe we can start quoting Paracelsus. He had some very interesting things to say, but I just find that really funny, a bit of cherry picking there, that he's quoting Hippocrates about the humors. Now, he says, in the final analysis, we should have listened to Hippocrates. So why aren't I just sitting here saying, isn't this wonderful? Dr. Paul Offit agrees with me. Look, he must be so reasonable. Well, here's why I'm not saying that. First of all, after all this time, presumably he's known about this since the 1970s, because these articles have been out since the 1970s. Presumably, just like every doctor in training, he was happy to lower fevers with fever-lowering drugs. And if he wasn't, why wasn't he talking about this in 1989 when there was a massive measles epidemic, and we know that one of the treatments has always been to give fever-lowering drugs. And we now know, and he is even admitting that that is the wrong thing to do, that it prolongs viral shedding, that it decreases the ability of the body to fight, meaning that the bacteria and viruses can go deeper internally. It cuts the immune system off at the knees. Why wasn't he talking about this then? Why wasn't he saying this in 1989? Why now? Why, after 50 years of people knowing this, is it now front page news? And guess what? It's not actually even front page news. It should be broadcast all over the place, probably more than go get your flu shot. Because guess what? If you're listening to what your doctor's saying because they want to get you out of their office and lower your fever, and you take that fever-lowering drug, you are the person that is putting the herd more at risk, because your child is not going to display the same symptoms. They're going to go back to school sooner. They're going to be back in the population sooner. They're going to be shedding virus for longer. So why aren't we screaming this from the mountaintops more than we're talking about vaccines? He talked about chicken pox, about how lowering the fever in chicken pox can make for a worse case. Well, if it wasn't for those worse cases where the staph and the strep kind of took over the skin, then the vaccine wouldn't be perceived as something that we actually need. And another thing I've been saying for a long time is that it's because of these fever-lowering drugs that the perception for vaccines has gotten greater. So if you don't give your child fever-lowering drugs and their body's able to mount a normal immune response, the likelihood of having a secondary infection is much lower. The same thing goes for meningitis. It's very well established for decades now that if you treat meningitis with a fever-lowering drug, you're putting that person at higher risk for more invasive disease, for meningococcal infections. That's true. We know the same has been true for measles. We know that much of the treatment for measles over the years has centered around symptom resolution and not around support of the immune system. So, manufacturers have made a fortune over these fever-reducing agents. Tylenol, acetaminophen, aspirin, ibuprofen, you name it, they all pretty much do the same thing. Oh, I just want the baby to feel better. I want the child to feel better. Well, actually, you're the one that's going to feel better because you think you did something. But you should actually feel worse when you give your child these drugs, because what you've done is actually put them at a disadvantage. And doctors should be ashamed of themselves for following orders, automatic orders in a chart for admission that says, if fever greater than 101.5, administer Tylenol. Shame on them for agreeing to that. I always scratch that order off because it never made sense to me. So why is Paul Offit talking about this now? I don't understand. And I've been sitting here wondering about it, and I was thinking, well, I mean, I'm not going to get too much into conspiracy mind here, but there must be a reason why all of a sudden this is being spoken about. And the only thing I notice is that Vioxx, which was Merck's baby for the longest time, which is a non-steroidal anti-inflammatory drug, had a bit of a disaster. And there were $950 million settlement to the US government over that. And I looked today, and I could be wrong on this, I'm going to admit that, but I don't see where Merck has any patents for these non-steroidal anti-inflammatory drugs. So I'm just wondering, is it safe for him now to talk about this because there's no more Vioxx for Merck, and because Merck doesn't have patents for non-steroidals? You know, it's Johnson & Johnson that now holds the patents for, you know, the Tylenols. And just let me tell you another little story, is that, you know, there's a little mother in New Zealand named Hilary Butler who years ago wrote an article about Pamol, which is their version of Tylenol. And she wrote it for what was the Immunization Advisory Committee. And she was threatened with a lawsuit. Actually, not more than threatened. The lawsuit was put against her by Pfizer. And so, because Hillary always has the medical literature at her fingertips, she just blasted them back with the medical literature. And guess what? They backed away from the little mother from New Zealand, and they ran scared and dropped their lawsuit. And subsequently, Pfizer dumped their drug on Johnson & Johnson. It's a funny little story. So if you want to read more about that, I advise you to go to Hillary's blog called Beyond Conformity in New Zealand. So, you know, the Advisory Committee on Immunization Practices is continuing to recommend more and more vaccines. They just added a third dose of MMR this week, if you're not aware of that. That is to be given during epidemics, during breakouts.
Is there an age group on that, or is that just... Anyone
who's had 2 vaccines. I don't know the exact. I'm going to guess that it's probably with 10 years expiration or something like that. So I would fall into that category of someone who should get the vaccine according to the new recommendations. And you know, the CDC still recommends to give fever-lowering drugs before and after the vaccination for meningococcal B vaccine in infants. And so they basically say that a total of 2.5 ml doses of infant paracetamol suspension should be given. The first dose should be administered at the time of vaccination or as soon as possible afterwards. The second and third doses should be administered at 6 to 8 hourly intervals after the previous dose. So I wonder, what do we think about that now, knowing that we're inhibiting an immune response, that we're putting the body at a disadvantage if we give these fever-lowering drugs? Now, these drugs, I believe, these recommendations are because doctors get a lot of phone calls after these vaccines are given, these meningococcal vaccines, and it's a way to dampen the immune response. But what happens if you, say, inject a baby or a toddler with an MMR, live viral vaccine, or you inject them with, you know, killed vaccines with aluminum, and you shut down their immune response? What about the adventitious agents that are in those vaccines? What about the things that Judy Mikovits talks about all the time with these retroviruses? And now the body's defense is trying to deal with this invasion, and you're telling it not to, even after you gave them that actual invasion. I think this is another thing that needs to be seriously scrutinized and discontinued. So I think that I would feel better about Dr. Paul Offit's recommendation if he would own up to his own use of this drug in the past and to what that's done to herd immunity, what it's done in the perception of the need for vaccines in the population, the mistreatment of diseases using too many antibiotics, which he has admitted to, and these fever-reducing drugs. Note, when you see a case of death after meningitis, that it almost always says that the child or the patient or the teenager was first treated with antibiotics and fever-lowering drugs. That is always a red flag to me. And so when somebody wants to say, oh, you know, we need to get vaccinated because this one person died, I say, show me that child's medical record. I want to see that medical record before I will concede that there was nothing else that could have been done, or there was nothing that was done that shouldn't have been done.
So in my day, when we had fevers, we had lots of fluids, but we did have cold flannels on our head, which I think I remember you saying that's not very good either.
Well, the cold flannel, if anything, I think it makes the mother feel better, and it might help with a headache.
It was wonderful
if you have a headache. Yeah,
when you were hot to have that.
So if you're really super, super hot. But the thing that happens, let me just explain what happens with fever, because I probably wouldn't have known this if I didn't learn it in medical school. So when you're having an infection and your body is saying, I want you to have a fever, what first happens, remember, you felt really, really chilly. You might not remember that phase. Most people remember the sweating more. So you feel really, really chilly, so chilly that, like that lizard who will go do any length to get into the sun, kids just want to be bundled up in blankets. When I have a fever, I want to be bundled up. And you remember me in Australia, all I did was hover underneath massive amounts of feathers. So that's the first phase of a fever, and that's when the body is telling the hypothalamus in the brain, we want to raise the set point of your temperature, because the temperature is always being regulated very narrowly in your body. And so what it does is it raises that set point and says, when you get to there, then you can shut off. So when the body gets up to a certain degree, that's when you start to feel hot finally. That's when they say the fever has broken, okay? And that's when you start to sweat. That's when you start to put salt water basically on your skin, which helps you deal with skin infections or the eruption of an internal infection onto the skin. So while it might make you feel better, it's not necessarily helping you. But I would say if I had a choice between giving a child a cool flannel on the forehead versus an internal fever reducer, I'd pick the cool flannel any day of the week. I don't think it's a good idea to chill people down. They don't find that actually helps, even in intensive care units. Chilling them down. But if it's just for a little bit of fever, just put a little cool flannel on the forehead, fine, no problem. If the child says that helps me feel better, because you're not actually changing their temperature when you do that. You're just cooling down the surface of the skin.
So another question, and you may not be able to answer this. So when Billy had his seizure, when he came out of his eyes rolling back and we were rushing him to hospital, he then started chattering, his teeth started chattering, and my natural reaction as a mother was, this child is freezing, and I wrapped him in a blanket and held him close to me till we got to the hospital. And when we got to the hospital, they unwrapped him and said that was the worst thing I could have done. Why?
Well, yeah, I was actually going to get to this whole thing with Billy, because I remember you and John telling me that they had you giving Tylenol around the clock.
Oh, yeah,
much
before and after,
all happening.
Lots of it.
So, as far as I'm concerned, if their statute of limitations wasn't up on Billy's case and there was documentation, you would have had a slam dunk win in court. Because pretty much everything they did, from the time that last injection went in, that vaccine onwards, was documentable medical malpractice. You know, they gave a vaccine injection to a child who was on antibiotics and was acutely ill. And then they told you to keep giving fever reducers afterwards. Then he has a seizure, and they make, what did they make up? That it's his brain set, it's sorting itself out. So they're trying to console you with lies. They tell you it's the worst thing to do to wrap up a child who has chills and to just let him have chills. And then they continue to, and so instead of that, they tell you to lower his fever with a drug that we know.
And then more antibiotics.
And more antibiotics, right. So they pretty much put his gut and his immune system at as much of it. It's really lucky that he survived the entire thing.
I know that now.
And everything John did afterwards to reestablish his gut flora and get that inflammation down is the only reason Billy is as functional as he is today.
And he only had the MMR that day compared to what those poor families have had to have in their children at that age now.
Yeah. So this whole thing, you know, when I hear parents, I was in Target the other day, and in front of me, this was really upset woman was talking to the doctor. Yes, well, I have him on the amoxicillin, and I'm giving him Tylenol round the clock, like you told me, but he's still not getting better. And I'm sitting here like, oh, why do these doctors continue to do this? Why don't they notice that it's not helping? This is why I think doctors get depressed, because they have so much cognitive dissonance and they don't know what to do with it. All they know how to do is get rid of symptoms the best that they can, and then the parents keep coming back with sicker kids, or unfortunately, sometimes dead kids. So why aren't they looking at this? Why doesn't this make sense to them? Everyone in medical school learns the physiology of fever. Why didn't it appear to them as crazy as it appeared to me that lowering that physiologic response mechanism puts a person at a disadvantage? What's wrong with these people?
I don't know. And one thing really disturbs, slightly coming off fevers now, and I don't expect you to answer this, but one of the things that's gravely disturbed me as I've gone on this tour and listened to the stories is the SIDS babies, that the parents find them and they're blue, and the parents that revive them, or the paramedics that revive the babies back to life. They then have to go into hospital. They go into hospital with an alive baby, and they're told it's not the vaccine, so no one's going to look at that. And then they go on to do these tests and administer drugs and lumbar punctures and goodness knows what else, and then the baby dies. There's something, I'm afraid to tell you, very sinister in those babies that stopped breathing, came back to life, and then went into hospital, and then they pass away. There is something very sinister there going on.
It is, and you know what else happens after that is they become organ donors. And I think the organ donation procurement process, you know, I know so many stories behind the scenes that makes me just say, you know, there needs to be so much better regulation here than there is, because there are too many doctors that have the wrong idea. I'm just going to be really conservative and say that.
But I'm not saying that they're purposely killing them. I'm saying that these doctors it seems to me that they go by the book. I have to do this and I have to do. They're not listening to the parents at any point.
And I'm agreeing with you, and I'm saying that, I'm not saying they're killing them, but I'm saying is they don't know how to bring them back. And they're trying to do it all the wrong way. And then when they fail, they just go, oh, well, there still can be organ donors. That's a good thing. We can still give you, when the fact is that those babies shouldn't be organ donors at all. A lot of this stuff should have been caught very early on.
Really interesting.
Yeah, I know. It was a case that I've kind of been peripherally involved in. It's just a horrifying case of mismanagement of a toddler from probably like the first month of life. And it's the classic story. Toddler goes in, gets its first round of vaccines, becomes ill, goes back with an illness, gets fever reducers, gets antibiotics. The cycle continues on. And then when the toddler's 9 months old, failure to thrive, falls off the growth curve. Nobody documents it in the chart except for the nurse who put it on the growth curve. The calcium and phosphorus levels were off. They gave a prescription of vitamin D probably after the fact. then the baby's left with the babysitter, and the baby dies, and the babysitter is sued. But the baby's brought into the hospital pretty much dead on arrival, but not so dead that the organs couldn't be procured. But what's startling is that the initial coroner just said that it was a shaken baby. And so that's the other problem. So you have your SIDS and you have your shaken babies, and there's always somebody that's going to get blamed for all this mismanagement.
Do not let your children babysit people. I can't stress this enough. Carry on.
And well, they found that the baby had rickets, and had vitamin C deficiency. So as long as you're giving these fever-reducing agents, by and large, change the way the liver is able to detoxify any kind of toxin, the electron donor capacity, and the N-acetylcysteine and those chemicals in the liver that help to detoxify, they're pretty much consumed really fast when you're given these drugs and the antibiotics, and then the infection and the vaccines with the aluminum. So vitamin C deficiency is a huge deal here. So really, why isn't Paul Offit coming out, if he wants to really get into the science and the physiology, why isn't he talking about ascorbate? Why isn't he talking about the benefits of those kind of toxin reducers? Instead, he's writing books about why we shouldn't be using those kind of supplements.
The peeps say that Dr. Paul Offit is going to come out with a vitamin C protocol very shortly.
Hilarious.
Watch this space.
Yeah, it'll be like 10 milligrams. That's what the recommendation will be. But I just want people to realize, that there have been articles around for so long about the improved. I have here one of my PowerPoints that I did a couple years ago. Survival is improved since 1978. Weinstein published 1980 Makowiak, and 2000 Makowiak. Makowiak's articles are fantastic. Mackowiak. If you want to look at those, some of the more compelling articles, really startling to me when I was looking into this, weren't just the predictors of mortality with regard to fever. But it was the, bringing it up now, Schultz, 2008, the PMID number 1844577. Schultz talked about basically went and looked at the cases of autism related to the acetaminophen use, and found that there was a huge number of I'm going to give here the 5 years of age or less, the operative risk if they had acetaminophen was 6.11, and some of those numbers are even more impressive. The presence of illness concurrent with the MMR, huge numbers here. 20.9, odds ratio of 20.9. That means that if your child that they were 12 to 18 months with autistic disorder, that they were 20 times more likely to have been given acetaminophen at the time that they were vaccinated. That's a huge deal. Why isn't he talking about the problems with giving these drugs during vaccination? There's still a lot more that needs to be discussed. I'm still just really curious why this article came out now.
Okay, so I'm going to ask one more question for you. Maybe not one more. Just one question I want to ask you. So, not that long ago, you got a high fever when you were in. How did you treat yourself? So this is not you giving advice to anyone. I'm just asking how you treated yourself when you had a high fever.
Well, I tell you, there was not one fever-lowering drug taken during that entire thing. And so I just slept whenever I had a chance. So we were basically on the road, and there was no stopping. I had to continue speaking. I had to continue doing all the obligations that I had. So aside from those times, anyone that was with me can attest that if I was in a car, I went to sleep. If I was home, I went right to my bed and went to sleep. And so I just tried to get, because when we're not active, our immune systems and our livers are able to do a lot more when we're not eating. So I didn't eat very much, and I just lots of spicy soup is what I wanted, like bone broth with lots of hot things in it, and tons of vitamin C, because I knew that at least if it wasn't going to immediately get me better, it was going to give my body give the neutrophils what they needed to keep functioning. It was going to decrease the inflammation that was roaring out of control. But I just let the fever burn. I didn't even measure it. I mean, look, I co-parented 2 kids. There wasn't even a thermometer in the house. I think that the invention of the thermometer really brought in some big trouble.
Yeah, and then in my kids, we had these things you put on their forehead, and it would say, alarm, alarm, give Tylenol, give Calpol, immediately. Call
the doctor, I mean, doctor business must have gone up exponentially with the invention of the thermometer, because it was, don't call me unless, and then if it gets above that magic number, then you're supposed to call.
But how many recordings we have of the people not just in this country, but just a different name for Tylenol as we go around, saying that they called the doctor and the doctor said it's perfectly normal, and we have this from seizures to ridiculously high temperatures, perfectly normal, give lots of Tylenol. It's absolutely normal, just keep going with the Tylenol. That has to be, now we know what we know, medical negligence.
And there's still, I think he needs a follow-up article talking about what these fever reducers, especially Tylenol, do to the liver in turn. We know that the number one requirement for liver transplantation is on, it's not on intentional overdoses with these drugs, it's on accidental overdoses in people who are taking them around the clock for certain conditions. So the detriment on the liver and on the detoxifying capacity of the liver is huge and should not be underestimated. And I think that Dr. Offit needs to come out talking about that. I think he needs to mention how many years he has been given these drugs and recommending these drugs, what he was taught in medical school, and how that has affected the perception by the public of the need for vaccination.
And that will be that.